ろしくお願いいたします。
Good afternoon, ladies and gentlemen. I'd like to thank Dr. Akiyama and AMD for the opportunity to speak to you today about my experience with the AMD and PUTTY hands-on courses. My name is Christopher Huang. I am a general dentist from Sydney, Australia, and an international member of AMD. Today, I would like to just give a brief introduction about my encounter with Dr. Akiyama and the Three-Step Akiyama Method, and the initial steps to master the Three-Step Akiyama Method. So when I first started doing dentistry, I was just looking at the mouth with my bare eyes. And I had a lot of pain from bad posture. After a while, I started using loupes, and I was able to see a bit more clearly, but I still had a lot of back pain. I then found out about ergonomic loupes, and that helped to make my posture a lot better, but sometimes I would still put myself into strange positions. I wanted to see more, but with less pain. So whilst doing a short endodontic course in Sydney, I was able to try out the surgical microscope, and I was amazed at how much I could see with the microscope and how comfortable it was for endodontic treatment. Unfortunately, I don't have any slides or statistics from Australia, so I've just got this slide adapted from Dr. Minami's presentation regarding the US statistics. But as far as I know, in Australia it's probably quite similar, but microscope usage by endodontists in Australia is quite high, but not very widespread in other fields. With microscope usage usually limited to endodontic treatment or restorative or prosthodontic treatment. Additionally, most general dentists that I know of do not use a microscope, and loupes are becoming more common, however. So whilst I was researching to purchase a microscope for the clinic, I was very shocked when I discovered Dr. Akiyama's YouTube channel. These are some of the videos that I was watching. If you'd like, you can scan the QR codes and find out more. So Dr. Akiyama had a very unique way of using the microscope, and he was not only using the microscope for endodontic treatment, but for a whole range of treatment, and mainly without the use of the mirror. And he was performing very difficult treatment, and I wanted to find out more. With the Three-Step Akiyama Method, you're able to see with direct vision without the use of the mirror, without awkward positioning, straightening the neck and back, and this allows for efficient and accurate treatment. So, what are the steps I took to learning the Three-Step Akiyama Method, and how can you do the same? Well, no one else in the world was using the microscope in the same way he was, so I knew I had to come to Japan to learn from Dr. Akiyama directly. So this is sort of a run of the various courses that you can undertake to learn about the Three-Step Akiyama Method. So firstly, we'll talk about the AMD hands-on course. This is the single-day course that was held yesterday, and it's in this course you can learn about the hidden realities of the surgical microscope. For me, I think this course was a very interesting course. It was very fast-paced, and there were many different interesting exercises that revealed some of the illusions that one might encounter when using the surgical microscope with direct vision and the dental mirror. Whilst the microscope provides magnification advantages over the naked eye loupes and the benefit of coaxial lighting, Depth perception is more difficult with the naked eye loops. So next I'll talk about the surgical microscope principle course. This is a 2-day course, and it expands on the exercises of the previous AMD hands-on course. Taking this course, I was able to use the microscope with the dental mirror more effectively, understanding the limitations of the mirror technique, such as difficulties using the mirror to view a deformity on the lower arch. And I think this course gave me a lot more confidence in addressing the limitations of the microscope with the mirror. The next course I undertook was the surgical microscope course. So this is the, on this slide you can see the details of the surgical microscope course, which is a 2-day course, and this is the course where you learn about the Three-Step Akiyama Method, which is a systematic direct vision technique. And in this course, we learn in detail about the 6 basic positions for direct vision. In this course, I met some really amazing guys, and yeah, I was really privileged to be a part of such a fun and interesting class. So, for me, I think the surgical microscope control course was the key course to learning how to use the microscope for more than just endodontics. Dr. Akiyama's method of utilizing the wide range of motion of specialized microscopes is quite revolutionary, and I think it provides a whole new way of viewing the mouth. Whilst there are only 6 basic positions to learn for the Three-Step Akiyama Method, mastering all these positions for all treatment will take a lot more practice on my behalf. And I'm looking forward to seeing where that goes. Here's just an example of me viewing the upper right posterior teeth. First with the naked eye, with loops, ergonomic loops, and then also using the microscope with the Three-Step Akiyama Method. And I think you can see the benefits of the posture with the microscope in this position. I'll just briefly also touch on a few other courses. This is, on this slide, there is the surgical microscope carries GSAF course, which is 2 2-day courses, and covers Dr. Akiyama's restorative and periodontal techniques. There's also the surgical microscope periodontal microsurgery course, which is 10 single-day courses covered every several months, and covers in detail the use of the surgical microscope in periodontics. For dental hygienists, there's also a 4-day course. For further information, please contact AMD. So, what is AMD? AMD is the Academy of Surgical Microscopic Clinical Dentistry, established in 2016 for dental practitioners who wish to master the Three-Step Akiyama Method. And it runs the single-day AMD hands-on course and runs conferences and seminars related to the Three-Step Akiyama Method. It's not just an association for learning, but it's an enthusiastic network of dental practitioners, and it allows you to membership allows you to participate in some of the more advanced microscope hands-on courses run by Mati. And here's some more photos of some fun things we did outside of the studies. I was really grateful that I was able to go with Dr. Kakuma down to near Mount Fuji to see the pagoda and Mount Fuji with the cherry blossoms in the background. is also likely to be able to participate in Dr. Akiyama's lecture in Germany as well. So we had a great time there. So yeah, I think if you want to learn more about the Three-Step Akiyama Method or how to use the microscope better, I think joining AMD would be a really great thing. Yeah, and I think it's just a great community of fellow practitioners as well. So definitely is a lot of fun being there. Just briefly as well, MATI, the Minami Alps Training Institute for Microdentistry, was established in 2007, and this is Dr. Akiyama's private teaching institute, and runs the Three-Step Akiyama Method hands-on courses. For further reading, I can recommend 2 books. The first one is in English and it's available on Kindle, the one on the top, and at the bottom is the Japanese textbook as well. For more information, you can contact the AMD email address, or you can also have a look at the Japanese and English YouTube channels as well, and refer to the AMD website. Thank you for your attention. Thank you.